I'll give you mine by tonight.
Alright, where are we?
We're still here.
Okay.
Where you going? Light, camera, action.
You get it, right? You said it to me.
Okay, I'm just want to let you know that the function of the chambers of the heart, like for example, if the atrium, they are the receiving chambers, the ventricles are the discharging or the pumping chambers. Now, if they ask you, what's the function of aortic semilunar valve? What's the function of aortic semilunar valve? Huh? It is the passage of blood from the left ventricle going to the aorta. Okay? Now, if they ask you what's the function of pulmonary semilunar valve, it is the passage of blood coming from where? Right ventricle going to the pulmonary artery. So if they ask you what's the function of mitral valve, the passage of blood coming from or from left atrium to the left ventricle and so on and so forth. Now, a pressure before and after the heart contraction. It depends upon how much blood can the heart pump. If the pressure is too much, what do you think is the amount of blood? Is it less or more? So if the example, my heart pumps so much, okay, more than it should be. Like for example, tachycardia. Okay, what is the amount of blood? Is it less or more?
More. Less.
How? I answer. Because I am working extra hard. Remember I told you I am working extra hard because it's not enough. Okay? Now, if we have a lot of blood in the heart, do you think I can pump more? I can squeeze myself? No. Because it's too big.
Too much blood.
Okay? Okay? Now, if I am pumping so much, what is the heart rate? High bradycardia or tachycardia? Okay. If I am putting so much blood in the left ventricle, what will be the effect of the pumping of the valve? Is it low or high? Low. Okay? Therefore, if ever that there's what you call, I am already vagina. Now, there's what you call pressure before and after. It depends upon how much the blood. Now, urinary system. What are the three main organs of urinary system?
Kidney.
Kidneys,
Bladder.
ureters, and bladders. No, you have only one bladder, okay? Bladder. Which is lower, right or left kidney? Right.
Right.
Why? Because of the presence of the bladder? Liver. How many nephrons do we have? Each kidney?
1 million.
According to Ojalat. 1 million each kidney. What is the main function of the kidney class? What's the main word function of the kidney? Filtration. When you are talking about filtration, is it merely or exclusively water or blood?
Water.
Good job. Blood. Okay. Blood. Good job. Okay. What is the primary function of the kidney? Filtration. Okay. Like I said, I filtrate what is good and I filtrate out what is not good. And then it turned out to be water. It turned out to be urine. Okay. Now, what are the structures of nephron? Where can you find Bowman's capsule?
Bam.
Ben? No. Bowman's capsule is here.
And the renal corpus.
Very good. So the renal corpuscles, okay? And then as the renal capsule, it will go out. And then later on, it will become, the Bowman's capsule, the renal capsule, and then later on, it become what?
Glomerulus.
Glomerulus. And then later on, it will become
Renal tube.
No, not yet.
Oh.
Proximal convoluted tubules, lobar memory, distal convoluted tubules, and collecting duct. What is the extension of the ureter going to the kidney? What do you call that? Letter R.
That's pelvis.
Very good. Renal
Renal pelvis.
pelvis. Okay? OG knows it. Now, what is apparent and efferent? Plus same thing, just apparent and efferent, same thing as what happened in the brain. Going, apparent, efferent is out. So, apparent is going to the glomerulus, to the circulation, and efferent going out from the kidney. Okay? Same thing as the word same, if you still remember that. If you don't remember the same, you have to remember the difference. Now, where does the location of the ureter and bladder? So, if the ureter, it comes along after the renal pelvis, and then later on in the bladder. What's the main function of the bladder class?
Movement.
Storage or the storage in the capacity of the urine. Therefore, how much urine can the bladder accommodate in order for you to initiate micturition, voiding, or urination?
1,200 naman.
600.
Oh, half of
Okay?
it.
Because you're right. Our bladder can accommodate 1,200 to 1,500. But we're asking how much urine can initiate the capacity. But for already Medicare patients, it has only 200 or 300. It has already what we call urinary incontinence. By the way, what is meant by urinary suppression? Senior finance. You are suppressing the, I know, you said that. So urinary suppression is that there's a presence of urine, but there's no amount of urine that goes to the
After the exams, all the things that
or
I
going
learned
out.
from-
Now,
from-
gastrointestinal system. What are the two parts of gastrointestinal system? You have your primary and accessory. When you say accessory digestive system, can you give me the main accessory digestive organ?
Mouth.
Liver. Okay. Now, primary. Where can we start? From the upper and then the lower until the epiglottis, and then in the stomach. What are the two hormones can be found in the stomach? These are the two acids. The hydrochloric acid and pepsinogen. What are the three parts of your small intestine? From up to lower. Duodenum, jejunum, ileum. How many feet is the small intestine? 20. Okay? So, in other words, where does the vitamin B12 usually absorb in the body? Terminal ileum. Okay. On your exam on Wednesday, we don't have that because you're going to take the exam on the other side, so you cannot see that structure, so you cannot see ileum. Okay? Now, what else? Now let's go with the carbohydrates, protein, and then fats, your favorite. Now, carbohydrates. What are the three components of carbohydrates? 1, 2,
Monosaccharide.
3. That's it. Carbon, hydrogen, oxygen. What are the composition of your protein? Carbon, hydrogen, oxygen, and nitrogen. What are the three types of carbohydrates? Monosaccharides, disaccharides, and polysaccharides. Can you give me the three monosaccharides? Glucose, galactose, and your favorite, fructose. Now, where can you find fructose in the body aside from the digestive system? It's only exclusively for male. In
the sperm.
Yes, the sperm. Well, can you give me 3 examples of disaccharides? You have your maltose. Okay, what
And
else?
no.
Lactose and sucrose. Can you give me 2 main polysaccharides? Starch and glycogen. By the way, where can you find glycogen in the body? Liver. Remember that glucagon, it will be converted into glycogen, into glycogenesis, and then the glycogen into the blood, gluconeogenesis. Oh la la. Now, protein. What are the two types of protein? Structural and functional protein. So, wait, can you give me two examples of structural protein in the skin? Collagen and elastic fibers. What about functional protein? Can you give me some example of functional protein? Hormones, vitamins, catalysts, and enzymes. Now, let's go with the protein. What is the building block of protein?
Amino acid.
Amino acid. So, if you have that protein in the body, what is the, for the three, you have your carbohydrates, protein, and fat. What is the main source, first main source of energy? Is it carbohydrates, protein, or fat?
Carbohydrate.
What's the second source?
Fat.
Protein. Fat.
Fats. Okay? Now, if your fats and protein, if your fats and carbohydrates are not good enough, then protein.
Protein.
Now, what are the digestive enzymes that we know in the body? Of course, the most common is pancreatic enzyme. It is most commonly found in the small intestine. And then, of course, can you give me the enzyme found in the mouth? Salivary amylase. By the way, where does the digestion of carbohydrates takes place or begin?
The mouth.
Very good. And what about the protein? Pancreas? Small intestine. Okay. Now, small intestine. Now, what are the parts of large intestine? From small intestine going to outside.
Ascending, transverse, descending.
No.
It's a large intestine.
Large intestine.
Function. Absorption of
Cecum, ascending,
transverse, descending, rectum, and I'm sorry, sigmoid and rectum, and then now body. Yeah. What is that support? What structure that support the ascending and transverse column?
Hepatic duct
Blood sugar. What is that structure that support the transverse going to the descending?
Splenic.
Why do you call that yellow thingy that are responsible for absorptions of water in the large intestine? I will ask you to know the spelling. Plica. What part of the small intestine where you can find the lymphatic nodules, the one in the histology? Start with the H in the ileum. Okay, remember that. What part of large intestine? I'm sorry, what part of digestive system that is responsible for the presence of absorptions of water? Colon. Okay. Now, hepatobiliary. When you say hepatobiliary, what are the components of hepatobiliary? Okay. First, let's trace it first. From the first part of the duodenum, it will go to the ampulla of bladder. It has two ducts, namely pancreatic duct and common bile duct. The pancreatic duct, it will go to the. Why is it that pancreas is only one? Why is it pancreas? Isn't it supposed to be pancreas in this junction? So pancreas. What are the two cells that can be found in the pancreas? The main two cells. Alpha cells and beta cells. Alpha cells secretes what hormone? Glucagon. What about beta cells? Don't forget that. That's why you have to say GABI. Now, the common bile duct, it will split into two ducts, namely what? Cystic duct going to the gallbladder, and then common hepatic duct, and then common hepatic duct, it will bifurcate into right and left hepatic duct. By the way, what's the function of gallbladder?
Produces bile.
Concentrate and store bile. What about the liver? Can you give me three functions of liver?
Also filtration.
First of all, is with this bile.
Synthesize, produces bile, and then removal of waste or toxins, and then of course circulation of blood. Now, hepatic abnormalities. can you give me one problem of the liver secondary to drinking alcohol? Cirrhosis. Okay? Cirrhosis, what, you have a patient like, okay? Now, I just said that a while ago, the vitamin B12 absorption takes place where?
Ileum. Internal ileum.
The nervous innervation of digestive system, it will start first from the absorption, it becomes parasympathetic, and then the other way around is sympathetic. It's not sympathetic and para. It starts first with parasympathetic. Now, endocrine. What are the two, what do you call the master gland of the body? That thingy. Pituitary gland. Okay, what are the two parts of pituitary? Anterior, of course, and posterior. Can you give me the two only hormones that can be found in the posterior pituitary? ADH and oxytocin. What's the meaning of ADH? Anti-diuretic hormone. So if we meaning having anti-diuretic hormones, meaning what is the end product of the urine? Is it low, or is it less or more urine volume?
Less.
Less. Okay? That's why anti-diuretic. Now, if you having problem with diuretic insufficiency, what will be the volume of urine? Low or high?
What?
Because you cannot control your ADH, so deficiency, so it become high. Okay? If you have more ADH, then the less urine you have. Okay? Now, what else? What are the glandular functions? Thyroid. What are the three hormones can be found in the thyroid? By the way, how many thyroid do we have? 2. Can you give me the three hormones? T3, T4, and calcitonin. Okay? So, calcitonin. Now, remember I told you that what is the active form? Is it 3 or T4? T4. Okay? Now, for the calcitonin is selfish. It doesn't want the blood or the calcium to go out. Therefore, it retains so much calcium in the body. What about the parathyroid? It's other way around. Now, what's the difference between Cushing's and Addison's disease?
Cushing.
By the way, what's the abnormality if you have Cushing's and Addison's disease? What kind of hormones?
Moon phase.
I'm asking what kind of hormone?
I forgot.
Huh? So it's cortisol and glucocortisol. Okay? Now, if you have Cushing's syndrome, what will be the signs and symptoms? Like positive, elevated blood sugar. What else? Prone to infection. What else? Moon phase. So what about if you have hypo? That's what you call Addison. Like I said, you're driving to the Addison, Illinois, so you become nauseated, hypoglycemic, irritable, and then weakness, and then loss of appetite. Okay? So increase is Cushing's, decrease is Addison. So increased amount of glucocorticoids and cortisols is my cousin, and then it's too far is low. Now, pancreatic. When you have a pancreatic dysfunction, what is the main part in the blood that is affected? If you have a pancreas problem, you report this: diabetes, sugar. Remember, pancreas. Okay? So definitely, if I have a problem with the pancreas, it affects the cells, the B cells and alpha cells. So if I am diabetic patient, what will be my sugar?
High.
Low?
High.
I was writing. I'm hungry.
I know you're right. Now, what's the difference between type 1 and type 2 diabetes aside from number?
Type 1 is dependent.
So type 1, there's already destructions of the one producing the insulin, which is the beta cells. So therefore, you really need direct insulin. In type 2, the one producing the insulin is good and it's producing normally, but the body doesn't know how to use it properly. Okay, remember that, casino? Okay. Regulation of testosterone. What is testosterone? Where can you find Where can you find testosterone?
The testis.
Testis. What part of cell can you find testosterone? Let him, with confidence. Go ahead.
Go ahead.
Oh.
1, 2, 3. Ding, 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 ding.
It's interstitial cell.
Sorry, OG.
You guys.
You should know that. And circulating all over.
You also should.
Whenever you.
I
Okay.
know that one.
Now, what are the functions of your testosterone aside from sperm, aside from offspring, aside from whatever? So it's secondary sex characteristics. Okay. So we guys, our boys become lower, and then we do have this, you know,
Mustache.
and then we do have what we call less fatty, or I'm sorry, adipose tissue. Female reproductive system and male. So I know for male, what is the main gonads for female?
Worry.
Ovaries. What do you call the main set of newborn for the female?
Huh?
No,
What did you say?
it's
What did you...
He's right, I'm about to ask that, but ovarian follicles. Okay? And then after that, puberty, primary follicles, how many? 400,000.
400,000.
And adult is only 300 to 500. Okay? So what is responsible for producing a baby for male, for female? What do you call what's the hormone for female? Estrogen?
Explosion.
Testosterone, I'm sorry, estrogen, progesterone, or
GNRA.
okay, or what we call the gonadotropin hormone. Good job, gonadotropin hormone.
Gonadotropin
For the
hormone.
female, same thing as testosterone is the estrogen, secondary sex characteristic. So, what do you call the first time for
Menarche.
ladies to
Menses.
menarche? What about when you are not menstruating for the past 6 months? Okay.
You're pregnant.
Menopause, or other name is Medicare. No. Okay. Menstrual cycle. What are the 3 stages of menstrual cycle, Miss Marie?
Proliferative.
No.
What?
Menace.
Menace?
Menses.
What
Menses.
I forgot all it.
Proliferative.
And then
Ovulation.
and ovulation and secretory. So, what is the longest among the phase?
Second.
The ovulation.
That's the shortest one.
Oh,
What's
that's
the
right.
So, if that's the longest, everybody.
Then the proliferative.
Huh?
Not secretary.
Secretory phase. Okay? You reported that. Okay? Good job.
I forgot it.
I know, you throw it away. Now, for that cycle, what is the distinguishing characteristic? How many days is usually the menses?
5.
5 to 7.
It depends actually, okay? Okay, it depends. For the usual, how many days is the cycle?
28.
28. So if a patient has 30-day cycle, what is the day usually for ovulation?
Minus 14.
So it's on the 16th to 18th days, okay? Don't say 14th day right away, okay? So when it is ovulation, what is what's the hormone that is usually higher?
Progesterone.
Luteinizing hormone, LH, okay? So on the first part of menstruation, estrogen is higher, and the lower part is the progesterone. If you are already pregnant, what is the estrogen level? Increase or low? It's not that low. And progesterone is higher, okay? Now, in the placenta, what is the main hormone in the placenta that can protect the baby? Miss Marie, Cabañeras.
The amniotic fluid.
Gonadotropin hormone. Okay? Good job.
Those I forgot.
I know. Now, site of spermatozoa, by the way, you ladies, you usually get pregnant because of fertilization and everything, and the baby, it should be in the uterus. When the baby is outside the uterus, what's the
Ectopic.
most common location?
In the
Fallopian tube. That's why it's called extrauterine pregnancy, and it's called ectopic pregnancy. In ectopic pregnancy, it is usually occur on the first trimester. Okay, on the first 12. Now, vagina. I know.
You're calling a student named Vagina.
Vagina.
Is located?
Okay. What is, I got lost.
Vagina. Oh, you can talk.
Vagina! Dr. B is calling you.
Okay. Vagina. What's the main function of vagina?
We should finish to be second.
What?
So we should finish doing sexual intercourse and normal delivery of baby at the end of pregnancy.
Okay. Actually, vagina's dual purpose is when you make it and when you remove it. Okay? When you make it during sexual intercourse
Oh,
to deliver to receive the penis,
delivery.
and then later on after 9 months, if luckily, if
Delivery.
it's normal, to remove the baby. Usually, they say, well, where you go out after.
I think
okay?
it's triple.
What else? What's the next
The
one?
secretory, like the menstrual cycle, the urination.
Okay. Now, what part of the female reproductive system again that is responsible for lubrication? Before you read
No.
gland.
Yeah.
Okay. In guys, what's the synonyms? What's the same thing as for the guys? Start with the letter B, not Balthasar. Bartolome.
It's called Cooper.
Bartoloi.
Yeah, Cooper. He mastered the mail. Yeah.
And both.
I'm gonna sit beside OG.
Okay. Now, the nervous system.
Okay.
What are the 3 parts of nervous system?
Brain, spinal cord.
No. Peripheral nervous system,
Oh, okay.
central nervous system, and autonomic nervous system. Here we go again.
That's my report.
I know. I'm gonna get your grade. Then you're planning to get scholar 4.0. Oh, now, for the central nervous system, can you give me the 2 main organs? Brain and spinal cord. Now, for the peripheral nervous system, can you give me the organ? You report again. Okay, it's peripheral nerves and cranial nerves. Okay, the peripheral nerves, how many are they? They are the same thing as the 31 spinal for the vertebrae. Now, the cranial nerves. How many cranial nerves do we have? 12.
12.
You're wrong. 24. Each of us is 12 pairs. 12 pairs.
Oh, okay.
You want evidence? There you go.
I didn't know. 24.
There you go. One here, one there, one there. There you go. Oh, clever. Look at that. Olfactory nerve, optic nerve. Okay?
Makes sense. There's 2 sides of the brain.
Unless you have only one part of the brain. Now, cranial nerve number 1. Oh, the categories within the heaven. Oh, olfactory. What organ that is responsible for olfactory nerve? Smell. Okay, no. Olfaction. Cranial nerve number 2. What is cranial nerve number 2? You should master this on Wednesday. What? Optic. And then it's for the eye, of course. Cranial nerve number 3. Oculomotor. Cranial nerve number 4. Trochlear. Cranial nerve number 5. Trigeminal. Cranial nerve number 6. Abducens. Cranial nerve number 7. Facial. Cranial nerve number 8, which is your favorite in the ear. Vestibulocochlear. Sometimes they call it acoustic nerve. Cranial nerve number 9. Glossopharyngeal. Cranial nerve number 10. Vagus. Cranial nerve number 11. Spinal accessory
nerve.
and super heaven. Hypoglossal nerve. That's why heaven, you're gonna use your tongue. That's what you call cranial nerve number 12. Okay? Don't think otherwise. Now, for that, sympathetic and parasympathetic. Here we go again. The autonomic nervous system is subdivided into 2. You have your sympathetic and parasympathetic. In sympathetic, you still have the preganglionic and postganglionic. In parasympathetic, you still have preganglionic and postganglionic. Now, the neurotransmitter. What are the 2? It's either norepinephrine or acetylcholine. Where can you find norepinephrine exclusively in the autonomic nervous system? Sympathetic postganglionic fibers. Remember that? You have your sympathetic, parasympathetic, preganglionic, postganglionic is only in the postganglionic sympathetic. The rest is all acetylcholine. If it's acetylcholine, what is the fiber? Is it adrenaline or adrenergic or cholinergic?
Cholinergic.
If it's acetylcholine, if it's acetylcholine, is it cholinergic or adrenergic?
Cholinergic.
Cholinergic. Remember, don't put both A. Okay. I repeat. What is the neurotransmitter that can be found in the parasympathetic preganglionic fibers?
Adrenaline.
Acetylcholine. You don't have any problem with parasympathetic. Is it a pre or post? It's still acetylcholine. Because you have only one problem in the sympathetic post-ganglionic. If you see the word parasympathetic, it's either both, it's already acetylcholine. If it's acetylcholine, it's already cholinergic. If you see both, if you see preganglionic, whichever preganglionic, is either sympa or para, still acetylcholine. Because the problem will only be in the postganglionic sympathetic. So if I ask you now, what is the fiber can be found in the sympathetic preganglionic fiber? Sympathetic adrenal, sympathetic preganglionic, what's the fiber? Cholinergic fiber, because it's acetylcholine. So what is the neurotransmitter? Where can you find in that area that I mentioned? Acetylcholine. So what is the neurotransmitter that can be found in the sympathetic postganglionic fiber? Norepinephrine. Okay, neurotransmitter. And what's the fiber? Adrenergic. Remember, the problem is only in the sympathetic postganglionic. Okay, because the rest is all acetylcholine and cholinergic. When you say sympathetic postganglionic, it's the norepinephrine only. Okay? Oh no, we don't have male reproductive, Mr. OG. I know, right. Now, what is CVA? Cerebrovascular accident. What's the other name for CVA? Stroke. Oh, I thought you were getting stroke right now. Now, CVA is when you have a blockage of coronary artery. Okay? Sometimes middle cerebral artery. And then, what is usually the problem? If I do have a stroke or CVA on the right side of the brain, what will be my problem on my extremities?
Left.
Left. It's always contralateral, okay? So if you see your boyfriend or your partner that you always do that, he doesn't know how to do this. Oh, you might have CVA or like that. Okay? And then if you notice that he always chew on the right side, not on the left side, oh, I got on the CVA on the left side. Okay? If my weakness is on the left and I have a strong point on the right, where do you think is my CVA? Right or left?
Right.
If my strong point is on the right and my weakness is on the left, where's my CVA? Right. Alright. Because my wrist is left. But it's contralateral. Oh, yeah. We just discussed that when you were not here. Okay. So, what is multiple sclerosis class? We're almost done. What is multiple sclerosis? What type of multiple sclerosis? When you have a problem with the motor neuron, okay? With the dorsal root, and then the problem with your dorsal neuron. Cerebral palsy. What are the characteristics of your cerebral palsy? If you see our discussion, there's a small boy with that, okay? So cerebral palsy, what do you think is the problem in a patient with cerebral palsy? The muscle, the weakness. And then, do you think cerebral palsy is genetic?
Is that a birth defect?
Birth defect? Do you think, where do you think is cerebral palsy usually affect? It is usually on the childhood or adulthood? Childhood. Brain injury. It depends upon what location of the brain. Example, if I have a brain injury in the dorsal part of my brain, what will be my main problem?
Your balance.
Good job. Vision. Occipital. Okay? Occipital. Remember, if I have a problem with the occipital, my problem will be my vision. If I have a problem with my hearing, what will be the part of my brain that is affected? Temporal. If I do have a problem with my cognition and recognition of senses, and a problem with, example, motor and sensory activity, what will be part of my brain? Parietal. Okay? If for my memory, it's usually the frontal. That's why, you see, it's so easy to remember for the memory. That's why remember when you don't know the quiz, you don't know the test.
I know that.
See, that's
That
why.
comment.
You cannot say, that's the one that when you don't know what.
Oh my God.
No,
She's
you do
pregnant.
that. You do that when I ask you question in your report, as if you want
I
to
don't
close
know
your
it.
eyes. Okay? You want to close your eyes because you don't know the answer.
How about your third girlfriend pregnant?
Okay. Now, musculoskeletal system. Musculoskeletal system. Now, for the plane, I'm not plane is the Asiana. So plane, when you say plane, what are those plane? Like for example, sagittal plane, mid-sagittal, okay? So what's the difference between sagittal and mid-sagittal plane? The spelling. Okay, mid-sagittal is 50-50, and the center, the cut it should be on the half 50 half. Okay, while the sagittal center is on the right eye or on the left eye. So, what's the other name for transverse plane? Horizontal. Okay, the horizontal plane, it divides the body into superior and inferior. Okay, so it divides the body into right and left equal halves. What do you call that plane? Mid-sagittal. Okay? Okay. If my patient having appendicitis, where's the location of the pain on the quadrant? Right upper. Oh my God. Our patient.
Lower.
Right lower. If my patient, if my patient is constipated,
Lower?
where do you think is the location of the pain based on the quadrant? Left lower. If my patient having UTI and unable to, or having urinary suppression, what is the location of the pain based on the region? Hypogastric pain. Okay. Now, if your patient having peptic ulcer, okay, where is the location of the pain based on the region?
Upper.
Based on the region.
White upper.
So it's on the epigastric area. So if my patient having cirrhosis, where's the location of the pain based on the quadrant? Right upper quadrant pain. Now type of muscle. What are the type of muscle we know? Smooth muscle, okay, skeletal muscle, and cardiac muscle. For those three, which do you call having intercalated disc?
The cardiac muscle.
What's the other name for cardiac muscle?
Myocardium.
Which of the three, which do you say it's supposed to be voluntary in nature?
Skeletal.
Skeletal. Which do you think is known as no striation at all?
Smooth.
Which do you think has striation?
Cardiac.
Skeletal and
Cardiac.
cardiac. If they are involuntary in nature, can you give me the two muscles? And skeletal. What do you call the pacemaker of the heart?
Essential.
What's the thickest part or layer of the heart?
Myocardium.
Okay. Now, structure of the long bone. The upper are called the epiphysis and the middle is the diaphysis. Where is the location where the RBC production in the long bone? Epiphysis. What about the fat tissue? Medullary cavity. That's why the osteosarcoma, it is usually found in the epiphyseal bone. In the diaphysis, the chondrosarcoma because of the cartilage. Okay? Now, don't get argued with the lateral epicondyle, medial epicondyle. Okay, what is the importance of oxygen when you have a muscle contraction? That's the go. Having muscle contraction. There you go. Oxygen. Huh? What is the importance? What is the role of oxygen for our muscle during contraction? It replenishes the loss because whenever our muscle contracts, it uses oxygen and energy in the form of what? ATP. So if you are using muscle until it will get fatigued, what is the acid that is usually increased? Lactic acid. So that's why if you put oxygen, what will happen to the lactic acid? Decrease. Same thing class as oxygen and carbon dioxide. That's why in order for you to get enough muscle contraction, you need to have an interval. You cannot do muscle contraction 1 hour without rest. You cannot do muscle contraction like first time it's 2 hours right away. It's supposed to be increased in resistance little by little. Okay? So the role of oxygen is to give nutrients to the muscle. Now, what is the neurotransmitter related to the bone and muscle? What do you call that hormones or neurotransmitter in the muscle? What is that hormones in the muscle and bone?
What is it?
What is it?
Guessing game?
I'm doing now.
Actually, okay, the muscle and the bone, they are related to a certain neurotransmitter. First, of course, is the acetylcholine also, but somehow it is related to contraction and relaxation. But in somehow, there are some minor hormones that are related. But in other words, example, if I ask you what vitamin that is related to the bone,
Vitamin D. Calcium.
calcium is mineral. D. So calcium is mineral. Where can you find calcium? Can you find in the bone or muscle? Bone. So if you have less calcium in the body, especially for those who are already menopause, what will you have? Osteoporosis. And then later on, you're gonna use your Medicare to order for pain. Okay? Now, let's go to respiratory. We're almost done, class. What are the two muscles responsible for inspiration?
Two? Diaphragm.
And lungs.
You cannot see that in exam, the muscle in the ring. External intercostal muscle. And then what are the two muscles? That muscle can be found in expiration. It's not change.
Diaphragm.
Abdominal muscle and internal intercostal muscle. Now, during inspiration, what will happen to the lung?
Expiration.
Increase thoracic cavity,
Diaphragm
increase
will down.
atmospheric pressure, and the diaphragm will contract. When you say contraction of diaphragm, move downward to give space for the incoming oxygen or air. During expiration, it's the other way around. Decrease in thoracic cavity pressure, remember the word elastic recoil, because elastic recoil is just going back to the normal. What will happen to the diaphragm? Relax. So if the diaphragm relax, what will happen? Push up. Okay? So that it pushes the air that's not needed in the lungs. Now, where does the gas exchange takes place?
And the lungs.
I know, but what part? Alveoli. By the way, what's the difference between right and left bronchos aside from spelling? Which is more vertical?
The right.
Right. Therefore, the aspiration is more on the
Right.
How many lobes do we have in the right lung? Three. Why is it so on left only two?
Because of the heart.
Okay. Now, what's the main function of the pulmonary? Exchange of gases, okay, takes place. Now, according to Miss Lorena, that's what you call pulmonary function test. Okay, so the importance of pulmonary test is to know the capacity of the lung, how it can carry so much pressure for the diaphragm in order for it to contract to produce breathing. Normally, how many breaths per minute do we have?
18 to 20.
Okay. In some other book they say 16 to 20, but clinically it's until 24. But remember, class, when your patient is already on 25, it's already been tachypnea. Okay? So if your patient having hyperventilation, what's the acid-base imbalance problem?
Pulmonary acidosis.
Very good. Now, if you are having anxiety, especially on Wednesday, what will be the acid and base balance? So if, for example, on Wednesday you want to pee all the time, what will be the ADH? Increase or decrease? Decrease. Okay. Now, regulation of respiration is nothing on the medullary center and the pons and the cortex, still in the brain. But what is important there is you have your aortic and carotid sinus that are responsible for chemical buffering of the respiratory. So therefore, the one that is what you call, that's why if a patient has bradycardia or decreased heart rate, they usually do this. Okay? To have the carotid sinus to stimulate. But class, mind you,
Milking?
don't do this if your patient having tachycardia, it might die. Okay, having a rate.
What is it called, sir? Milking?
Huh?
It's called milking, right?
Milking?
No, the one that you're doing.
Is the carotid sinus massage.
There's another term for that.
I don't know. I know something, some in milking. I don't know what that is. Okay? So, class, please concentrate on the reviewer or, I'm sorry, guidelines that I gave it to you. I hope somehow it helps the one that we had the review today. And please study the guidelines that I gave it to you, and then you'll be good. My agreement to you, class, if you get 75, I will add at least 75. I will add 7.5 to your theoretical exam in the final. If you got 80, that's already 8.0. Okay? Make sure that you have to do as much as you can. If your grade now is still C, you can still fail. Okay? If your grade now is C, you can still B. If your now grade is B, you can still A.
I need A.
Okay? 4.0.
Yeah.
4.0.
4.0.
4.0. Okay. Now, class, in taking the exam of ATI or comprehensive exam, you cannot go back.
Why?
Why not?
No way.
No way.
For this one?
Yeah, you cannot go back.
This coming Wednesday?
This coming Wednesday, not next Wednesday.
Oh, yes! Jesus Christ.
Already
That's two already.
Yes.
I told you. I told you.
Why?
I told you so.
Excuse me, class, please come early on Wednesday so that we can still a little, wrap up with the topic if you want to. And most of all is you need to come as early like 4:30 or 4:35 in order for you to sign up with ADI. Because that's another login for you. The ADI is your bridge taking all the exit exam, going to the predictor, and going to the green light so that they will sign your paper to take the board exam. This is the first step for you. Okay? So, this time, we will know those 4.0. Okay?
Do I have to go laptop?
You don't need... by the way, for those who have laptop, you can bring. Because we have only 12 in that room. So, how many are you? So, can you please bring at least 2 or 3? Okay?
I'll bring.
Okay, you can bring yours. Okay.
I'll bring mine.
I'm not bringing.
Okay, guys? So, excuse me, don't worry. I'll pray for you, okay? I'll pray for you.
4.0!
Just remember, we have only two numbers. 4.0. Like a Nike model. 4.0. 4.0.
Dr. B, I need .30 to have 4.0.
You already got the finals.
That's right.
You can, your grade will be incomplete. Because there's,
Yeah. I'll put it in YouTube.
The problem.
Never on YouTube?
Excuse me.
Oh, good. Put it
Oh,
on
so
YouTube.
what's the for the YouTube, please?
Your video. Yeah, put it. You're very famous now.
Okay. Excuse me. If you cannot take the comprehensive exam on Wednesday, I cannot promise it to you that this is the same review. Because in your comprehensive exam, you have your what we call your batch 1, batch 2, batch 3. And this review is for batch 1. Meaning this is set A. So they say it's volume 1. So I don't know, but I don't know if it's still gonna be same topic, although of course we don't know the question. I don't know if it's same topic that it will be specific. But I can guarantee you, these are the specific topics that you can concentrate for the volume 1. Okay? So, and if it's on like that, I don't think we need to order 2 more for you because it's additional.
So how many hours, sir?
There's 2 hours and it's only 70 items.
That's a lot.
That's a lot. But the problem, class, you cannot go back. But you cannot stay for a long time in one question. Why? You
Whoa.
will pop out.
Oh my
Stay
God.
with it.
What?
Excuse me. Oh, you gonna say that, oh my God, during your NCLEX? Because in NCLEX, if you stay more than 3 minutes in one person, you will pop out.
No way.
And you
No,
lost it.
you log out.
Why do you have to punish us like
That's why, please, read the question 3 to 4 times, because anatomy are direct. Okay? At least you have to spend at least 1 minute and 30 seconds each question, you're good.
Did you make the question?
No,
You
it's
made them.
ATI. It's ATI.
Ah!
If I made the question, it's more difficult. So it's ATI. So that's why I don't have control for the ATI. That's why they gave me the modules so that I will know what are the topics for volume 1. This is volume 1 and volume 2 and volume 3. I'm sorry, I don't know. Okay? So good luck, guys. I will pray for you on Wednesday. Please come early. Thank you. What time? I